Hi, everybody out there. My name's Michelle Manahan, and I'm here with Dr. Niru Anna to talk to you a little bit about what we wish we knew when we were younger. This is a series that we're starting for the Women in Surgery Committee, and I am really excited to be here to talk to Dr. Anna. Dr. Anna, would you like to introduce yourself?
I'm Niru Anna. I'm a board certified general surgeon. I did a fellowship training in surgical oncology. I have been in practice for more than 15 years. I recently relocated from New York State to South Carolina. I'm thrilled to be part of this. One of the major things that I wanted to share with new surgeons coming into practice is the importance of delegating and being able to let go. And I think that's a critical and a crucial learning lesson over the years. So over the years, one of the things that I learned in a very hard manner is to let go of the office administrative work and to let the office manager handle all the non-clinical office related issues and to just only take care of clinical care. The non-clinical aspects of care are never going to be perfect. Majority of the times there will be hiccups, there will be a shortage of staffing, or whether it's supplies or day-to-day running of the office, and letting the manager or letting the administrative component for your practice to handle those non-clinical administrative duties. To a degree, I think it took years to understand and even be able to let go, which is not very easy for most of us to do.
I think all of us have a lot of experience in trying to figure out when to let go and difficulty with it. And as you were talking, I was thinking, well, how much do you delegate with your office manager? I think you mentioned that he pretty much oversees all of the concerns that you have. Does he ever come to you with a problem, or do you ever say, give me a little bit of a review, let me keep my finger on the pulse somewhat? How do you achieve that balance? Is it somewhat of the relationship that you have with him?
Absolutely. Over the years, I think we come to the understanding where he brings all major issues to me, meaning if staffing is a shortage or if there are supplies and those are issues, he usually troubleshoots and tries to solve them and then gives me a review. In terms of letting go, that's just a phenomenon that you have to develop with your manager. And I think just letting go from the beginning or letting go of all administrative duties it's going to be difficult. So you'd let go and see how things are going and then let go further as things are progressing in the correct direction, of course. Trust in a relationship is a hard entity to work on, to build up, and it takes years and months, and having worked side by side with someone and having proper outcomes is how you build trust. And over time, I think as you see positive results and you build on the trust of the relationship with the manager, you're able to let go further.
What would you suggest in terms of how to start this relationship as manager? If you have a newer employee, how do you have that conversation? How much do you say, I don't want responsibility in X, Y, or Z. I want you to do that, versus feeling out how capable that person is in the beginning?
Sure. I think having an honest discussion and be upfront about the practice and being able to state the goals of the practice are important. If the goal is that we want our patients taken care of that minute, that day, that second, and we don't want messages to pile up at the end of the day when you come out of the operating room and you have 25 messages, we have to state that upfront. So the communication channel with the manager, I think, is key in order to develop a relationship that's trustworthy and also that serves the needs of the practice.
Well, thank you so much for all of those thoughts. We really appreciate you taking the time, being willing to share on behalf of everybody. We applaud you and thank you so very, very much.